Thank you for taking the time to learn more about the QOPI certification compliance process. My name is Meredith Klein, and I'm the program manager for the QOPI certification program. I'm going to be walking you through the basics of the post-survey compliance process. This presentation will be most relevant for practices who are currently applying for certification, especially those who have completed their site survey or are looking for guidance on next steps to take to demonstrate compliance. It may also be of interest if you're just wanting to learn overall about the QOPI certification process, and this will apply later on after you complete your site survey. So during this presentation today, I will review the basics of the compliance process and timeline. We'll talk about how to make sense of your certification compliance report, some tips for action planning and submitting documentation to us, as well as highlighting certification achievement and the process for ensuring that you maintain your certification. So here we'll take a look at the compliance process and timeline. Practices will receive the final certification compliance report. They will receive this about 3 to 4 weeks following their survey. The certification compliance report, you'll see we abbreviate as CCR through the rest of these slides, so it's the shorthand for our report name. Within 10 days of receiving the report, you will submit an action plan which describes the actions that you will take for any standards that were assessed as unmet during the survey process. Then you will have 90 days to implement your action plan after you receive your report. At that point, when the 90 days ends, you will need to submit your compliance documentation, and that will show us all of the work that you've completed from implementing your action plan. Here we'll look at the certification compliance report, or CCR. The surveyor will write their report communicating all assessments within 10 business days from the day of the survey. The report is then reviewed by ASCO staff and then by a committee reviewer, which is someone from a team of oncology expert volunteers. The committee reviewer is actually responsible for deciding when standards are met or not met. They will be pre-screened for any potential conflicts of interest with practices that they review. Something to keep in mind because of these 2 layers of review following the surveyor's assessment is that on the day of the surveyor is going to do preliminary results. They will talk about these with you and give you initial feedback. You may find that some assessments will change in terms of what's met or not met, and that is based on trying to ensure consistency from survey to survey, and that's something that our committee reviewers are always looking out for. So you may see slight variations in terms of what's met and not met from the surveyor's initial day of review. You will get this report and it will give you the official scoring for each of our 22 standards. So this is actually showing our table of contents. This is located on page 2 of the report, and it gives an at-a-glance view of the total standards that are met, partially met, or not met based on the surveyor's observations. The really nice thing about this table of contents, aside from just being at a glance how many standards you met or didn't meet, is that you can actually click each of the standards on the table of contents, and it will link you to the part of the report where that standard has been assessed. So it can be a great quick navigation tool as you're looking through your report. I wanted just to note that there are a couple of different terms here that we've defined. A partially met standard means that 75% or more of the standard is met. It will still have a standard or requirement assessed. It is an unmet standard, but it was close to being met. A not met standard means that less than 75% of the standard is met. Again, that's an unmet standard. It will also have a standard requirement. It just means more of that standard was assessed as unmet. The NA, or not applicable category, is used for standard 3.5, which applies only to practices that administer chemotherapy via the intrathecal route. So if you do not administer intrathecal chemotherapy in your practice, then you will receive that not applicable rating for standard 3.5. All of the other standards will either be met, partially met, or not met on this report. I also want to take a minute to note that we do not expect perfection during the survey process. Sometimes I would say about 99% of our practices are going to have at least a couple of standards that were assessed as unmet during the survey process, and that's okay. That's why we have this post-survey compliance process for you to complete afterwards. Every once in a while we get survey. However, that's usually practices who have been through the survey process before, and it is pretty rare. So for the most part, this post-survey compliance process is going to be done via remote document submission, and that will show us that you have found ways to demonstrate compliance after the survey. You're doing that kind of by showing your work remotely. In rare cases, based on the number of standards that are missed and kind of the severity of the standards that are missed, a resurvey or a second site survey may be required. And that's something that would be communicated to you as you are receiving your report. We would have a meeting with you, we would discuss some of the issues that were cited, and then we'll talk about some possible ways to meet each of those standards, and then kind of the next steps for scheduling a second site survey. Again, pretty rare, but just keep in mind that that is a possibility. So within the report, we have what we call standard assessment. So each of the 22 QCP standards and elements will be rated within the report. This is an example of one standard, standard 2.1. Initially, we'll see that there will be a rating of whether the standard is met. There are also checklists that are used throughout, which helps to simplify our documentation. Unmet standards will always have a note to explain why the standard is not met. Notes may also be included to highlight special features or processes of the practice. For example, all of our observation-based standards, the verifications, those will have at least a brief description of what the process was, even when the standard is met. But generally speaking, the checklist is going to be used to say whether the standard was met or not met. This particular standard requires a policy, so it has a checkoff to state that the policy was confirmed by your staff, that everything was in place as described in the written document. Then there's a section here because the standard requires patient documentation as well. At least 4 patients are evaluated, 2 IV and 2 oral patients. So this checklist is indicating that all 4 patients had consent documented in their medical records, and that means that the standard was met. The reports are not going to identify specific patients. They also will not identify specific staff members. Assessments should be generalized and state things such as IV patient 1 had a positive distress score without documentation of referral or support services offered, etc. The surveyor won't note specific staff members or name them. It may be a statement such as nurse 1 did not verify the expiration date and time of the drug prior to administration. There should be a general statement. The idea here is that if there's an issue with one patient's documentation or one staff's verification process, there are likely others out there. It's probably not just that one person or that one chart. And so the goal here is for practices to look after the survey and try to find that root for the compliance issue so that they can problem solve accordingly. So you're going to think about things such as, is there a different template that needs to be used that would help with documentation compliance? Or is this really a staff education or workflow issue? Maybe staff weren't aware of the process for ensuring that the appearance and physical integrity of the drugs is verified, for example. So adding that to a policy, adding to a workflow document, or even a cheat sheet can be developed, and that's not cheating. You can always have staff have references on hand to use even during the survey process. So those are all things to keep in mind. This slide is going to talk a little bit about the report requirements. So for any standards that are not met, they will have a standard requirement, which is filled in within that section of the report. This will describe everything that must be documented after the survey for the practice to be granted certification. So the report language is going to vary for each standard depending on what's required in that standard, but generally a requirement is going to consist of first identifying a solution to improve the policy or process that is found to be non-compliant. Second, educating staff who are involved in the new process and documenting their understanding. Documentation could be via meeting minutes, a staff sign-in sheet, some type of online education they complete with a record of that. There's a couple different strategies you could use for documenting the staff education. And then lastly, implementing those planned actions and monitoring for compliance. So afterwards, if you had a new consent form you're now using, then you would do chart audits after implementation to make sure that those consent forms are being documented, that they are completely filled out, and you would report those results back to us in terms of how many charts you looked at and what percentage of those were compliant with this process. So for the action planning step, as I mentioned, these are written by you and they're submitted within 10 days of receiving your report. You will get feedback from us on this action plan. So this is really future looking. So you're talking about what you will accomplish in the next 90 days. It doesn't need to be anything that you've already done, but you're describing the actions that you will take to meet the standard requirement. We're going to review these just to make sure that all parts of the requirements are addressed. We'll make sure that it sounds like you're on the right track to meet the standard before you implement. If there are some immediate things that you want to do after the survey before you're getting your report, obviously that's okay, but that's not necessarily required. We really just want to see this action planning step to see what will happen within that 90-day compliance period after the survey process ends. So this is an example of an action plan that was devised for a documentation-based standard. In this particular case, the practice had an issue with inconsistency in performing an initial psychosocial assessment for all of their patients. So the practice in their action plan establishes a timeline of 3 months to complete their plan, and they describe all of the steps that they're going to take when they implement. So first, they said they're going to create a new guideline outlining the psychosocial assessment requirements using a distress tool for all patients. Then they would plan required staff education, which reviews the new workflow and the staff responsibilities. Practice would submit documentation of the education, such as meeting minutes or slides used in their presentation. Then they would submit an example of the documentation for a test patient from their medical record system. And lastly, they would monitor results of implementation by performing some random chart audits, ensuring that staff are consistently performing the requirements, and they would report results of chart auditing to us. So that could take a couple of different formats. Usually it's something like a table which states generically patient 1, patient 2, patient 3, without using the medical record numbers, but de-identifying all of the patients, and they would report how many charts they looked at, and then percentage-wise, how many of those were compliant with the specific documentation requirement of that standard. In this case, having a psychosocial assessment documented prior to treatment. And they would report that to us. So if they found initially the first month of their monitoring, maybe they were only 70% compliant overall with this requirement, then they would document re-education of staff and then reassess the next month, take a look at 10 additional patients and see if they're improving and report those results back to us, hopefully approaching 100% compliance as they continue to monitor their results. This next example is looking at a process-based standard, standard 3.8, which is the chairside verification prior to administration of infusion chemotherapy. So in this case, the practice did not verify the appearance and physical integrity of the drugs prior to infusion, and they described in their action plan what they would do. The first step is they said they would update their policy to include that drugs will be labeled with an expected appearance. That's not something we require, but it was their opportunity to help cue staff to take a look at the appearance and integrity of the drug during the review process, was to have an expected appearance section on their chemotherapy label. They also created an information sheet describing expected appearance for staff to reference. So they have a reference tool that staff can go and check on if they're unsure. Then they updated their workflow document to include that staff will verify the integrity of drugs immediately prior to administration. Next, they educated their staff on the new resources they created, as well as the workflow requirements. Then lastly, they monitored compliance, and in this case, they did it by performing direct observations of staff in the infusion suite. So when we're talking about process-based standards, we're not going to accomplish monitoring based on the chart audits. We're actually going to do this based on observational audits, having someone take a look at and review staff in person to see that those verifications are in fact being performed in real time. So they would report, for example, the number of observations they completed and the percentage that are compliant. Other times they will actually have a competency checklist that they will fill out for each staff member, maybe evaluating 2 infusions per staff member. And that would be what they would document to show us compliance. So a couple of options there, but in general, it is all observation-based for these process-based standards. So for submitting compliance documentation, everything needs to be uploaded electronically through our application platform. There is a post-survey documents tab, which is the 7th one in the application. You will log into your application and return to it. And within that step 7, you will see a section for uploading documents under each standard. Now you'll find when you access this step that there are 22, all 22 standards are going to be listed. However, you only need to upload documents for standards that were assessed as unmet. So keep that in mind when you go in. You don't need to upload documentation for any standards that you met during your survey. When you're uploading documents, you can upload multiple documents per standard. You could do the policy and the staff education all separately, and the chart auditing, etc. Or you could do one multi-page document for each standard, making sure it's really clear what you did and kind of highlighting the important sections of your documentation. What's really important though is just to make sure whatever strategy you use for the document upload is double checking to make sure that you're covering all parts of your requirement for that standard. So if you're working on psychosocial assessments, you need to make sure you're showing an example of the template you're using for the assessment, and you're documenting that staff education as well as uploading your compliance results. So covering all of those pieces. Documents must not include any protected health information or PHI. This includes but isn't limited to patient names, MRNs, dates of service, initials of the patient, date of birth, etc. What we ask in terms of demonstrating what documentation is used in your medical records is to use a test patient if possible to show here's our assessment template we're using and here's some dummy data that's filled out. You can also use a blank copy of a template that's been developed to show us what's going on. If you are using a blank copy of a template, for example, a consent form, it's really helpful if you can actually fill in the blanks that are included in the consent with dummy data, so we know, okay, in this box, that's where they're going to put the drug name. This is where they're going to put the length of treatment. All of those pieces are kind of filled out, even if it's just with some dummy data. Then it's also important to annotate your submission and highlight important areas. So for example, if you're submitting a copy of meeting minutes, you can highlight and really zero in on the part that's applicable for that standard. You can actually kind of black out other parts if you'd like to that aren't applicable to your QOPI certification process. In addition, we just want to note that after you upload all of your documents, there is a button at the top of the page that says send review request. It's really important that you select that button. Otherwise, we don't get a notification and our staff won't know that it's time to go in and review your documents. You can also send us an email at our QOPI Certification Help Desk to let us know everything is ready for review. There will be a process where ASCO staff are going to summarize all of your documents. They will provide you with feedback if any information is missing or we have any questions about what you submitted. So there can be a little bit of back and forth if anything's incomplete. The last step is going to be for us to send our summarized copy of all of the work you've completed. We will send that to a committee reviewer who completes a second review and ultimately makes a certification decision. So that usually takes a few weeks after the time you've submitted your documents to do these 2 layers of review. And then that committee reviewer will decide if you've demonstrated after your survey through all of this work that the standards are now all met. And once that is done, a practice achieves certification. When you achieve certification, you will receive an email notification to let you know. You will also be able to clarify what practice name you would like highlighted. That can be highlighted on our website to show you on our certified practice map. You will also receive a complimentary award plaque and pin, which is a really nice display piece that you can show off at your practice. If you do have multiple sites or you want to have multiple plaques in your facility, additional plaques are available for purchase through our plaque vendor's website. So you can do that if you'd like. In the email notification, you will receive some electronic resources as well. There are social media templates, a local press release template, and a newsletter template, which can be customized and used by your practice to help announce your QOPI certification to your community. There is also a QCP patient brochure, which is more patient-facing guide to QOPI certification, as well as a QCP brand guide, which includes all of our logo files, so you can use those. It gives instructions on how to use the logos. So you can add those to your website, add them to your press release, etc. Lastly, just wanted to highlight some certification maintenance requirement tips. So every practice who wants to maintain certification will need to recertify every 3 years. In order to prevent a lapse in certification, we recommend starting the QOPI abstraction process in year 2 of your current certification. This is to help make sure you obtain an eligible QOPI score for the recertification process using that QCP track to get the overall quality score of 75% or higher. Once you have that, you can apply for certification within that year. Then the ultimate goal is going to be to make sure that you achieve your next recertification term before the current certification term lapses. And lastly, I wanted to provide our contact information. If you have any questions about the compliance process or more generally about QOPI certification, please feel free to reach out to our team. Our email address is available here, as well as our phone number. If you do call, just remember to ask for QOPI certification and the operator will get you to the right team. Thanks so much, everyone, for joining.